Good day, everyone. This meeting will tackle proper collection, handling, and preservation of urine specimen. Let's welcome today's lesson with an open mind and an understanding mind. To start, we have the following learning outcomes. First, explain the importance of proper collection of urine specimen. List 4 types of urine specimens and explain when each might be required. Explain why a preservative is required for some urine specimen, and then explain the proper way to collect a midstream clean catch urine specimen. List criteria for evaluating the specimen quality and corrective actions to resolve problems. Understand and follow the laboratory policies for record keeping and reporting. But first, how are you guys? How is everyone doing? What's up? What's poppin'? Charot. It's so awkward pre-recording myself. As in, like, talking without an audience. Like, di ko makakita sa inyong reaction. Charot. Anyway, I hope you're all doing fine. Slowly, but surely adapting to the pressures of being a third-year medical technology student. So it can be hard, it can be very brutal, it can be very hellish good. So I hope and pray you continue to strive forward. As early as now, dapat naamoy organizer or bisan weekly planner, or at least dili mo ma-lost if ever na ay assignments or exams up ahead. Okay, so take a breather first, and then let's proceed. So for today's lesson's rationale, examination of a patient's urine specimen can yield many results that are helpful to the physician in diagnosis and treatment. Of course, your urinalysis or also your SE or your stool exam are considered your cost-friendly but reliable tests. Proper collection of specimen is essential in order for the results to be valid. Good quality control requires that specimens be collected with care to avoid contamination and help prevent erroneous results. Improper handling of the specimen after collection can also affect the test result. So as always, we must be careful when receiving specimen in the lab. Okay, lisod kayo magkasinayop or mo-recollect ang patient. Most especially if OPD siya, lisod kayo siya pangayo aglaing specimen. So fast talk sa ta guys. For specimen collection, we have 3 components: containers, labels, and requisition forms. So containers, unsa man ang components ani niya or dapat unsay iyang requirements. So dapat clean, of course, dry, leak-proof, and disposable ang atong container. Kaya namang disposable, ma'am? To avoid contamination, guys. Kay base niya, wala giayo og wash ang mga containers, di kabalik-balik ra pod ang mga microorganisms or unsa pa na ang naadira. And then, sa pailain, wide mouth. Dapat wide mouth ang container for the convenience of the female patients. So later on, explain ko ngano convenient gid kaayo ang wide mouth na container. And then dapat sad flat bottom siya to avoid overturning. So dili makatikwa-tikwa. So pila man ang recommended capacity ana niya, ma'am? Pila man ang dapat? So the answer is 50 ml, 50 ml. So ngano man, it allows 12 ml kay 12 12 ml raman ato ang i-test. Muna siya ang ginanid nato for microscopic analysis. And then, if ever magkasinayop ta, pwede ta maka-repeat from the same container. And then, 50 ml kay para dili ta maglisod o mix or properly mix nato ang ato ang specimen. So, next, we have the labels. So, unsa man ang nakabutang ani? So, unsa man ang dapat natong ibutang? Of course, we must include the name of the patient, his or her identification number, or pwede sa hospital number, date and time of collection, and then pwede sa iyang age or iyang sex. Depende rin siya sa institution or the lab or the hospital kung sa ilang mga protocol. So, dapat ato ang label naka-attach sa container, guys. Dili sa lid. Dapat nasa container, sa body of the label. Kay lisod na, if naan ninyo siya sa taklog, ibutang. Kay, for example, daghan mo, bisihon ka na pagka-intern, pagkuanin mo, imong gitungan ng tulo ka specimen, and then label mo siya sa lid. So, how sure are you na patient A, yahad yun ang E, or basin nagkabaylo si patient B o C. So, muna na guys, dapat nasa body sa container ang label. And the next, finally, we have the requisition form or your request form or lab request form. This sheet of paper must accompany the specimen. Additional info can include method of collection or pwede sa type of specimen. Pwede sa mumubutang kung naay mga takbal kitumar si patient na maka-interfere sa test. And of course, dapat isulat sa nato ang time received na naabot siya sa lab. So next, we have the types of urine specimen. So we must always instruct the patient when they have special collection procedures. So we'll discuss further on sa mission mga special collection procedures. First up, we have the first morning or early morning urine specimen. This is the preferred specimen for most routine urine testing. It is ideal for screening purposes. So this specimen is normally more concentrated and usually has an acidic pH. So more concentrated siya guys, thereby assuring detection of chemicals and formed elements that may not be present in a dilute random sample. So tanan na adira sa first morning. Hence, it prevents false negative pregnancy tests and is essential for evaluating orthostatic proteinuria. So, I repeat, orthostatic proteinuria. Ma'am, unsa man yung orthostatic proteinuria? So, it is most commonly called as posture proteinuria. So, it is basically seen in teens or young adults. Discuss any further, kay malibog niya mong samot. So, if you want to read more, if na-curious mo, unsa ning orthostatic proteinuria, unsa ni siya pag-spell, ano na siya guys, pizza, ha? Kay tsada kay agi si ma'am. Or, wow, very nice. Or, one eternity later. Oh my God, guys, dili dyan siya. So, ang spelling ani kay ORTHOSTATIC. So, ortho o static. So, guys, so you may read this on your Strassinger na book. Naan ako diri kay 6th edition. So it can be found in chapter 5, page 76. So next we have your random urine specimen. So this is the more commonly tested sample. More common kind naman. It can be obtained anytime during the day. So walay koan guys, walay restrictions. Random urine specimen. The next, we have your timed urine specimen. So this is intended for certain tests. So it can either be any of the following. So dagan kayo tang klase-klase ng timed urine specimen. So we'll discuss this one by one. So first, we have your afternoon urine specimen. So this is collected between 2 to 4 p.m. It is best for the determination of bilirubin and urobilinogen. Next, we have your fasting or your second morning specimen. So it is the second voided urine after a period of fasting. And then, kani siya, it is recommended for glucose monitoring. Next, we have your catheterized urine specimen. Of course, it is collected using a catheter. It is recommended for bacterial culture and cytology. Next, we have your 2R postprandial urine specimen. So, kani siya guys, take note, it is used for screening and monitoring diabetes mellitus patients. So, lahi ni siya sa ato ang second or your fasting specimen. Kaya atong fasting specimen kay for glucose monitoring. Whereas ang kaning 2R postprandial kay para ni siya sa atong mga DN patients. Next, we have your 12R urine specimen. So, it is solely for the quantitative examination of your urinary sediments. Next, we have your 24R urine specimen, used to check for kidney function. Results obtained are quantified and are expressed as units with the milliliter or liter per 24 hours. So, example, ani na mga kinatest na to ani kay protein, creatinine, urobilinogen, and calcium. Next, we have your suprapubic aspirated specimen. Just like your catheterized urine specimen, it is also recommended for bacterial culture and cytology. And then we have 3 glass collected specimen. It is recommended for the determination of prostatic infection. Ma'am, unsa man ang 3 glass collection, ma'am? Unsa man ang prostatic infection? So, ano siya, guys? You have 3 sterile guys, containers. So, sa first urine, na imong first part sa imong urine, na mo pass or mo void, i-collect mo na siya sa first na container. And then, imong midstream na urine, i-collect mo siya sa second na container. And then, before ka mo-collect sa imong third specimen, dapat ang ato ang prostate. So, ato ang prostate can be massage so that prostate fluid will then be collected along with the remaining urine. So, tira na to siya iputang sa third sterile container. So, ma'am, nanatay tulo ka container, ma'am. How do we know na positive siya for prostatic infection? So, ani ni guys ha. So, ang third specimen, which is katong i-massage ang prostate, dapat ang iyahang WBC or your white blood cell count is 10 times higher than the first specimen. So, again, ang third specimen na WBC count is 10 times higher than the first specimen. So, ma'am, unsay pulos sa second specimen. So, muna siya guys, it will serve as your control. And then lastly, we have your favorite ng lahat, midstream clean catch or your MSCC specimen. It is used for routine screening and bacterial culture. So, itong MSCC provides a safer, less traumatic method for obtaining urine, and it is also less contaminated by epithelial cells and bacteria. So it is safer guys, less traumatic, and less contaminated. And lastly, we have your drug specimen collection o drugs. Kabahan na ang dapat kabahan. Charot. Bitaw-bitaw guys. Ato ang social yun na naatay chain of custody or your COC. Dili ni katong dula guys ha. Chain of custody ni siya. So, it is a standardized form that must document and accompany every step, good guys, every step of drug testing from start to finish. So, urine specimen may be witness or unwitness. So, pwede tamulantaw, pwede sa di tamulantaw. Depende ra na siya sa institution or your drug testing center kung unsa ilahang protocol. And then after guys, makakolect siya of urine, so we must take its temperature within 4 minutes. Dapat 4 minutes lang yun guys from the time of collection. So dapat makapasar siya in a range which is 32.5 to 37.7 degree Celsius. Kaya if dili siya makapasar ana guys, dili siya masulod ana na range, pwede na adulterated iyahang urine specimen or basin iyahang gitamper or gibutang ang tubig. So dagang kuan pwede possible na reasons ani guys. So dapat careful kita ani. So before we proceed, recall. So how do we determine gani guys? If positive si patient for prostatic infection, very good. So dapat iyahang WBC count is 10 times higher than the first specimen, ang third sample. So next, which is the more concentrated urine sample? Very good. Your first morning urine. Then, labels guys, labels. Sana all may label, charot. So, labels should be placed where gani? If sa container, asa na to ibutang? Very good. Sa body, sa container, and not the lid. Ideal specimen for pregnancy test. Bedaw sa correct, charot. Very good. So, ang atong first morning urine. Commonly used urine specimen. Unsa man? Random. Yep, that's correct. That's correct. Charot. And then last, recall. Urine specimen used to determine protein levels. Protein. Itong ginagamitan ni na urine. Your perfect. Love it. 24-hour urine specimen. Okay, so proceed na ta guys. Sources of contamination. So procedures for urine collection must be followed correctly, of course. If not, urine specimen may become contaminated with epithelial cells, your blood cells or your WBC or RBC, microorganisms, or excessive mucus or mucus threads. So clean or sterile disposable containers made of either plastic or plastic-coated paper or glass, pwede sad ang glass, can be used to collect urine specimen. For bacterial culture, of course, dapat sterile ang container. So katong naka-wrap o plastic or nakapalot sa plastic. So next up, we have the procedure for collecting urine specimen. So for midstream clean catch, a clean catch urine specimen is necessary if it is to be tested for the presence of bacteria. So most hospitals and physicians provide patients with a sterile disposable urine container. Male and female patients should be instructed to carefully collect the desired urine specimen, and then written instructions must be readily available to the patient, and these instructions can be posted in the restroom near the toilet. So, instructions to the male patient. So, the male patient should retract the foreskin of the penis if wala pa siya circumcised using a towelette or a clean wet wipes. So a second towelette should be used to cleanse the urethral opening with a single stroke. Take note, single stroke, dili balik-balik guys. Directed from the tip of the penis toward the ring of the glans. Towelette should then be discarded, and this cleansing procedure must be repeated using 2 or more towelettes. So the patient should begin to urinate or void into the toilet and then bring the container into the stream of urine and collect an adequate amount of urine. So muna siya inyong midstream. So middle portion sa imuhang urine ang imuhang gina-collect. So after the specimen has been collected, the lid should be placed securely, and then the patient should avoid touching the inside of both the container and the lid. Okay, so the information on the label should then be completed and attached to the specimen container. So, for us, female na mga patients, how do we do this? Charot. So the female should position herself comfortably on the toilet seat and swing one knee to the side as far as possible. She should spread the outer vulva fold or your labia majora using a towelette, and the inner side of one inner fold, your labia minora, should be wiped with a towelette using a single stroke from front to back. So, di ba, ang apakahirap, char. Apakahirap maging babae, char. So, nga namang front to back, kay usually, if imo siyang i-back to front, so gikan ka sa imuhang anus, so ang hugaw na noon, ang imuhang mga ang imuhang na noong mga kagaw dira, mubalhin na noon sa imuhang your genital. So, pwede na noon ka magka-UTI. So, careful lang ta na guys ha. So, the towelette should then be discarded, and a second towelette is used to repeat the procedure on the opposite side. So, muna siya, dapat i-cleanse ang urethral opening, and then, just like how the male collects his urine, dapat sa middle portion sa urine ang imuhang gina-collect, and then put the lid, information sa label, and then muna siya guys. Another note na said, if the patient has vaginal discharge, a clean tampon should be inserted to decrease the possibility of contamination. So contamination na siya guys, na ano lang ko, na typo. So next, we have your 24-hour urine specimen. So the procedure for collecting a 24-hour urine specimen must be followed carefully in order for the test results to be valid. The patient must be provided with a written instruction describing the procedures to be followed. So, ang 24-hour urine specimen must contain all the urine, guys. Dili rin siya midstream clean catch. Produced by the patient in a 24-hour period. Collection may usually begin at a designated morning hour. So, ato ang container, guys, is usually mga 5 liters ang ginagamit ani. Daghan jud siya, guys. Kay for a 24-hour period jud siya. So, kani ang procedure. So, to cut the story short, kay medyo taas kayo ang checka na ko ani. So, for example, your morning hour starts at 8 a.m. At 8 a.m., the patient voids and discards specimen. So, iyahang ilabay ang iyahang first ihi ana. And then, sa mga succeeding niyang ihi, yan ang i-collect. So, dapat tanan guys sa dili midstream. Dapat tanan dyan na ihi. And then, by day 2, at 8 a.m., mangihi si patient ana. And then, iyan na siyang i-add sa imong 24-hour urine collection. So, day 1, first urine, i-discard. Day 2, i-add. So, ano siya guys. So, when the specimen arrives in the lab, the patient information must be checked. The specimen should be mixed well by inverting gently or swirling the tightly capped container. So, example sa atong container guys kay kanina sa pictures na container. So, using a 100 ml volumetric cylinder, measure the total volume of the specimen and record it on the label of the specimen container and on the requisition slip or your request form. So, pwede sad inani patalaas or kapatindo ang iyahang container, and then usually inani ang pag-label, and then you can see sa third na picture inana siya kadaghan usually. So, last topic, we have the handling and preserving urine specimen. So, a urine specimen should be examined within an hour or within 2 hours, depende na siya sa institution. Pero na siya usually sa 1 to 2 hours after collection. If this is not possible, the urine may be refrigerated at 4 to 8 degrees Celsius for 24 hours only. So, kani siya na temp range, guys, it helps decrease bacterial growth and metabolism. So, for urine specimen that cannot be refrigerated or i-transport pa siya, a preservative must be added to it. So, urine specimen for bacteriological studies must not be preserved. So, gina-discourage ang preservation method basta ang ginabuhat kay bacteriological studies. So, muna siya yung mga common urine preservatives with their advantages and disadvantages. So, as this is just the common ones which can be found sa lab. If you would like a complete list, you can actually read it through your Strassinger book, 6th edition, chapter 2, it is labeled table 2 to 3, page 32. So, as you can see, guys, we have different preservatives, refrigeration, thymol, boric acid, formalin, toluene, and then naa siya advantages noon, pero naasad siya disadvantages. As you can see, the ideal preservative does not exist, Jude. Therefore, a preservative that best suits the needs of the required analysis should be chosen. So, Ang una-una to kay kung sa man ang test na kailangan ng patient. So, dapat atong preservative kay dili mo interfere ana na test. And then, of course, dili makomplete ato ang lab session if wala ato ang precautionary measures in handling specimen. So, we must consider all body fluids and tissues as biohazards. Always wash hands before and after each lab activity. Wear lab gowns, mask, and intact gloves when handling and processing specimens. Disinfect specimen first before discarding into the sink and flush with running water. Pero okay naman na i-discard diretso ang urine. So avoid splashes or creation of aerosols. And then we must store specimens appropriately. So that ends our discussion on the proper collection, handling, and preservation of urine specimen. Thank you so much for listening, guys. Thank you so much for being patient with me. I hope you learned a lot in this pre-recorded lecture. If you have any questions or queries, you can send me a private message via the Messenger app. So have a blessed and productive week ahead, guys. Goodbye and take care.